Hi, I'm Dr. Rick Kelly. Taking your blood pressure at home is a great way to be proactive in monitoring your own health. For those who've been diagnosed with high blood pressure, it's especially important. With the availability of inexpensive and accurate home blood pressure monitors, there's no reason for most people not to keep up with their blood pressure. Many people don't know how to use their devices correctly or may wonder if it is accurate. Not using the monitor correctly can lead to inaccurate readings, which can be dangerous for those with high blood pressure or many other conditions. Many patients have asked me, should they use a wrist monitor or an arm blood pressure monitor? In this video, I'll answer those questions and tell you the most important factors when choosing a personal blood pressure monitor. First, when you get a new blood pressure monitor, it is a good idea to take it to your doctor's office and make sure that you're using it correctly and that the results are consistent with the readings that they're getting. An observational study published in the British Journal of General Practice in July of 2020 concluded that doctors can be confident at the accuracy of patients' own blood pressure monitors if the devices are validated, are used properly, and are no more than 4 years old. The American Heart Association recommends that you take your monitor to your doctor once a year and make sure it's still getting accurate readings. But even the best blood pressure monitors can give inaccurate readings if they're used improperly. So here's some tips from the American Heart Association. First, don't smoke, drink any caffeine, or exercise for at least 30 minutes before you measure your blood pressure. Next, use the bathroom and then rest quietly for at least 5 minutes before taking a reading. Don't talk during that rest period or while you take your blood pressure readings. Wrap the cuff around your bare arm, preferably without any clothes between the cuff and your skin, and don't roll up your shirt sleeves, which could constrict your arm. It is best to sit on a sturdy chair with a supportive back, not a sofa or recliner, with your feet flat on the floor. Your arms should rest on a flat surface. The cuff of the device, whether it's on your arm or your wrist, should be at the same level as your heart. And it's a good idea to take readings at the same time every day, such as morning and evening. When you take your blood pressure, you should take 2 or 3 readings, 1 minute apart, and get an average, or just write down the readings. If you follow these steps, you'll get a much more accurate picture of how your blood pressure is running. Now, what about arm monitors versus wrist monitors? Both arm and wrist type monitors inflate automatically and then display a reading. Most are battery powered, though some of the arm monitors can be plugged in for power. Both types may have Bluetooth connectivity, so you can download and share the data with someone else, particularly your doctor. Some monitors have multiple user memories, so 2 different people can use the monitor and the blood pressure reading history can stay separate. So what are the pros and cons of each type? Well, the pros of arm monitors, generally arm-type monitors are considered more accurate. When you see your doctor, I expect they will always use a cuff on your upper arm. With arm monitors, the screen is larger, which may help those who have impaired vision. For the cons, having a cuff that fits correctly is essential. If it's too tight or too loose, you may get an inaccurate reading. That's a particular problem with people who have large upper arms. Some brands, like the Omron brand that I recommend, have monitors with slightly larger cuffs. Arm units may be bulky or not as portable, and some people feel like they squeeze harder and are not as comfortable as wrist monitors. The pros of wrist monitors, well, they are compact, lightweight, and portable, and they're usually more comfortable than arm monitors. And it is less likely that someone would have a wrist that is too large for a wrist cuff. The cons, pressure measurements taken at the wrist are extremely sensitive to body position. Some wrist and arm cuffs should be positioned at both wrist and arm cuffs should be positioned at a heart level for an accurate reading. And this could be more difficult for some people to get right with a wrist cuff. So wrist or arm monitor? Well, in the past, I have recommended the arm type because I believed that they were more likely accurate. But I have found, since owning the Omron Silver arm monitor and the Omron Gold wrist monitor, that both appear consistent and accurate and generally give readings within 3 or 4 millimeters mercury of each other. I feel perfectly comfortable recommending either of these monitors to my patients. Consumer Reports has reported that monitors in the $30 to $50 range sold at Walmart under their Equate brand are also good choices. Whatever monitor you choose, get it validated and follow the tips on how to get the best readings that I gave earlier. That way you'll be able to better monitor your blood pressure. In my experience, the most important factor regarding blood pressure monitors is using them correctly and having one that fits properly. As I've said earlier, a cuff that is too large or too small, and usually too small is the problem, won't give you an accurate reading. People often wonder if old batteries affect the reading. Well, while I do think that it's a good idea to have fresh batteries, I don't think that it's a big issue. And also, I think most monitors these days have a low battery warning, so they can be replaced if needed. If you use a home monitor, tell me in the comments what kind you use and if you're satisfied with it. What has your doctor told you about using them? If you have any questions for me, just leave them there in the comments. As always, thank you for watching. If you found this useful, like and subscribe. Take care